Finance Minister Nirmala Sitharaman in her budget speech mentioned the government's aim to eradicate sickle cell disease in India. The move has a political strategy behind it, as the eradication of the disease, prevalent among tribal communities, will give greater impetus to strengthening healthcare and health awareness in tribal areas. A mission to eliminate sickle cell disease in India will be launched. It will entail awareness, creation and universal screening of 7 crore tribal people in the age group of 0 to 40 years in tribal areas and counseling through effective measures of ministries and state governments, Sitharaman said in her budget speech. Health Minister Dr. Mansukh Mandaviya welcomed the decision and said sickle cell anemia, or sickle cell disease, is prevalent mostly in the tribal communities of India. It affects hemoglobin responsible for carrying oxygen into the body in red blood cells, which can result in morbidity and mortality via distinct pathways. Therefore, early detection and treatment of SDC is of utmost importance for improving our health as a nation, he said. Read Budget 2023. FM announces 157 nursing colleges. Mission to eliminate sickle cell anemia by 2047. Till now, more than 1 crore tribal people have been screened for SCD, of whom 8.75% have tested positive. The Ministry of Tribal Affairs MOTA has launched the Sickle Cell Disease Support Corner to bridge the gap between patients and healthcare services in tribal areas. The project is to be launched in mission mode from Chhattisgarh, where a sizable population is tribal. 7 crore tribal population will be tested through a screening test. Everyone who tests positive for or is a carrier of SCD will be given a color-coded card. Pregnant women will be screened, the Union Health Minister said. Screening will be done through point tests, although testing still happens in many areas but at a very low level. Both men and women will be tested, and if both are found to be positive, adequate counseling will be given to them, including the fact that they should not indulge in matrimony with each other as their children could also be seen carrying the same disease. The cards will help identify this, he added. Funds will be disbursed through the National Health Mission, and states will receive 60% of the funds from the central government and 40% from state contributions. Read what is sickle cell anemia that India plans to eliminate by 2047?